Welcome back. My next guest is Dr. Azhar Aslam, who is also a cardiologist. Welcome. Thank you for coming in.
Thanks for having me.
Now, Dr. Hollingsworth ended with, you know, if you're having symptoms, you got to take care of. You got to do it pretty quick. Get to the emergency room. But what happens if it happens, you know, in the shopping mall? Is CPR a good thing to know and learn if you have the opportunity? And we see these AEDs on the wall. Are they helpful?
Absolutely. You know, I will just reiterate a little bit. Most deaths related to the acute myocardial infarction happen to arrhythmias. I mean, the general understanding is that artery is going to be blocked, there's going to be massive heart attack, which is going to cause pump failure, but that's not the case. Even a small artery being blocked, causing fatal arrhythmias, can lead to death. So if someone who's having a heart attack, you know, in your friends or family, and they drop dead, and there's no emergency help available, immediately CPR should be started. And the new recommendation is that there's no need for mouth-to-mouth breathing. You can just do CPR, and you just have to push in the center of the chest as fast and as hard as you can, and meanwhile make sure that help has been called. Now, the AEDs and defibrillators are very vital, and in fact this is the landmark improvement in cardiovascular survival, that if you can terminate the arrhythmia with a sudden shock, it will, you know, stop death or reverse a sudden cardiac death, and then you can get to help as possible. AEDs are automated external defibrillator. These are programmed to identify the arrhythmia and shock. So it's really as simple as taking the AED, turning it on, slapping the pads on the patients, and just waiting. It will recognize the arrhythmia and it will shock them.
So that's what happens if you have a heart attack. But mainly you really want to prevent it before you get to that part.
Absolutely.
We talked a little bit about high blood pressure. What numbers do you pay attention to? Like 140/90, a good blood pressure?
No, it's not. I mean, if your average blood pressure readings are running higher than 135/85, it is technically hypertension. And there are different stages. It could be mildly elevated, moderately elevated, or severely elevated, which adds to your risk. And there are different treatments. And everyone with a mild elevation of blood pressure may not need to go on blood pressure medications immediately. And that is a lot of the anxiety in patients, that if my blood pressure is high, I'm going to go see the doctor, they're going to slap me on medicines. That's not true, because you will start one step at a time. But if the blood pressure is higher than 135/85 on most occasions, there's no need to kid yourself. It's important to go see the doctor and get it evaluated.
Salt, diet, exercise may be better than a medicine.
Everyone improves their blood pressure control by about 10 points if they can lose 10 pounds of weight. Even people with normal weight, if they can lose some weight, their blood pressure will improve. Because in the process of losing weight, monitoring your diet, you're going to eliminate unnecessary foods, which are high sources of sodium and salt, and that contribute to fluid retention and high blood pressure.
We also talked about cholesterol, and LDL is the bad cholesterol. Describe why that's bad, what it does, and some numbers that we ought to fix.
But you know, there is constant damage as a part of aging and you know, trauma from the blood pressure, smoking, you know, different traumatic agents harming the internal milieu of your arteries will cause injury and repair. And LDL is the particle, is a fat particle in the blood which is constantly circulating and is participating in that injury and repair process and building plaques. So if the LDL levels are high, that will lead to formation of blockages and plaque buildup. And the higher the level, the more risk. And you know, mostly we just carried away with this understanding that a blockage in the heart and a blockage in the artery going to the brain. But people have to realize that you have miles and miles of arteries in your body, and every vessel is at risk when your risk factors are not modified, when your blood pressure is high, when your LDL is higher than optimal.
And your HDL is a good cholesterol. You want that to be high. How do you do that?
HDL, well, genetically, some people have better HDL levels compared to others, but someone who really has low HDL level, the way to improve that is diet, regular physical exercise, and there are some medications which can also help with improvement of HDL levels.
Now, let's assuming that we've tried to prevent it, but we ended up with a heart attack anyway, and we got fixed. We got a stent, we got a bypass, whatever reason we got fixed. That doesn't mean you can ignore all this and go back to living a normal...
I'm glad you brought up this point. This happens a lot of the times. People will ask us that my cholesterol is normal now, can I go off cholesterol medication? Or how long my stent is going to last? I've had open heart surgery, why am I having the problems again? Because the mindset is that we're getting cured or we're getting permanently treated, but that's not true. Coronary heart disease, just like diabetes, high blood pressure, high cholesterol, these are ongoing processes, and they need to be addressed and attacked on an ongoing basis. So, anyone who has had previous established heart disease, stents, bypass surgery, or any other treatment, they should understand that now they have a diagnosis of coronary artery disease, and their risk of having future events is higher than anyone who has never had heart disease before. So there is more reason to stay very vigilant about cholesterol control, blood pressure monitoring, diet, exercise, visiting your doctors, having regular checkups.
But assuming you do all those things, control your risk factors, you can live a normal life. So you go back to normal activity, both exercise, sexual activity, all that's okay after a heart attack?
Well, usually we're very good about recommending cardiac rehab after cardiac procedures or major hospitalizations for cardiac reasons, and that's a very structured program where people get to exercise with physical therapists while their heart rhythm, oxygen level, blood pressure, etc. is being monitored. So this is a graduated level where they gradually increase their activities and get to a certain level. And for every activity that you perform in your normal daily life translates into a certain degree of stress on the treadmill. And that's a very good gauge of anyone who has accomplished this level, how much physical activity can they go back to.
Great information. Hopefully prevented some heart attacks today. Thanks for coming in.
Thanks.
We'll be right back.